और शेयरिंग हैगी
हो जाएगी
हाँ जी
तेरे को सोच
नहीं मैं उधर खाना बॉक्स
Good afternoon, sir. Welcome to the session.
गुड आफ्टरनून मैम
Yes, sir. Good afternoon, sir.
Good afternoon, madam.
Welcome to the session, sir.
Thank you, madam.
Good afternoon, Shama, Professor Shama sir.
Rajbadu, Professor Shyam Prasad. So again, welcoming you back. So nice to meet you after a few months.
Yeah.
Right.
और राज बहादुर साहब कैसे हैं आप? बहुत दिन के बाद मिल रहे हैं.
हाँ काफी दिनों के बाद मिल रहे हैं
Yes, yes, everything fine.
लगता है, आपके ब्रोशर से ऐसे लगता है that you think and your university think that I am not there on the job.
Yeah.
I am still working as a vice chancellor here, my dear.
Yeah, nice meeting. So today is an interesting topic. I hope it will be beneficial for all. Let's see that.
Good afternoon. I welcome everyone to today's topic in the series of webinars, SBV CONNEcT, proudly presented by Sri Balaji Vidyapith. I am Dr. Soumya, Professor and Head of the Department of Pathology and the Coordinator of the Medical Education Unit, moderating this session. The topic for discussion today is clinical laboratory services, their importance in modern healthcare and role in health science universities. I welcome the esteemed speakers for today's discussion, who are Vice Chancellors of renowned universities across India. My hearty welcome on behalf of our university to Dr. Shyama Prasad Pigilam, Vice Chancellor, Dr. NTR University of Health Sciences, Vijayawada, Professor Subhash Chandra Parija, Vice Chancellor, Sri Balaji Vidyapith, Puducherry, and Professor Raj Bahadur, Vice Chancellor, Baba Farid University of Health Sciences, Faridkot, Haryana. The clinical laboratory serves as the backbone of this hospital services. In a true sense to say, it is very essential, and at the same time, it is not noticed much. So we start today's session with a very important and informative note on the value of clinical lab services in healthcare by Dr. Shyama Prasad Pigilam, Honorable Vice Chancellor, Dr. NTR University of Health Sciences, Vijayawada. A brief introduction about Sir. Dr. Shyama Prasad Pigilam, he has done his undergraduation during 1977 and post-graduation in 1982 from SV University, Tirupati, and he has done his MCH Pediatric Surgery from Andhra Medical College, Vijayawada. He holds many prestigious academic and administrative positions in his career. He has received many awards. Some of them include the YMCA Award for Dedicated Humanitarian Services in 2007. He was also awarded Best Administrator and Doctor from KGH Visakhapatnam at the 65th Independence Day celebrations at the state event in Visakhapatnam in the year 2012. He has been also awarded U Social Welfare Organization Award and HIMA Humanitarian Association Award. He has received various awards from Lions Club of Visakhapatnam in recognition for his social services. And he has been awarded the Best Doctor Award by Healthcare International Hyderabad in 2013. And he has also been bestowed with Ani Mutyam Lifetime Achievement National Award in the same year. And Vidya Ratna by Kinnara Arts Hyderabad in the year 2017. This is only a very brief introduction about Professor Shyam Prasad. And sir, now the floor is yours.
Thank you, madam.
Thank you for being with us.
Thank you, madam. Om Sai Ram. Harihi Om. Very good afternoon. Respected Chancellor M.K. Rajagopalan Garu, Professor Subhash Chandra Parija, Vice Chancellor SBV, Professor Raj Bahadur, Baba Farid University of Health Sciences, Professor S. Soumya, MBE Coordinator, and staff members of SBV, students, ladies and gentlemen. At outset, I thank the organizers for giving me this opportunity to speak on value of clinical lab services in healthcare system. Next. My father and mother is DMA. Next. My family members, all of them are doctors. Next. My teachers. Next. The value of clinical lab service in healthcare system. Laboratory is the most and the least used resource of the healthcare system. First is mostly all other medical disciplines use laboratory as their either factory or a mine. Second reason is assumption that laboratory staff has insufficient clinical knowledge. Today, healthcare strives towards a more modern, efficient, patient-centric healthcare system. Even though the laboratory medicine is a part of the healthcare, it is neglected and less acknowledged. Laboratory service is a service for doctors. It is not a service for doctors. In fact, laboratory experts perceived as a service for doctors. In order to have a successful healthcare ecosystem, laboratory experts should have the same status as the experts in their own medical disciplines. But challenge is, laboratory experts hesitate to involve themselves more in structuring, ordering, and their assumption that doctors are ordering it in a regular, correct manner. It is a consequence of bad communication between medical department and laboratories. Initiatives to make laboratory experts act as medical consultants are being neglected. Repeating new and correct tests as well as pathophysiological interpretation skills, but laboratory experts in ideal situation to advise their colleague doctors on how to properly order and interpret laboratory test results. Modern healthcare systems are oriented towards developing a better communication between doctors and laboratory experts. This form of communication has enormous influence on the treatment outcomes of medical expenses in general. Here, the laboratory professionals are clinical optimization of operational services, survey of performance through appropriate designated quality control, improve testing appropriate, and educate clinical users, improve the decision-making strategies, improve the cost effectiveness. Totally, it improves the patient outcomes. This is called hands-on role at laboratory clinic interface, mutual vetting, consultation, interpretation, clinical license, and advice. How to embed laboratory in the modern healthcare system? The main goals are to improve information accessibility to the patient, speed up bringing the new diagnostic evidence-based technologies, redesign diagnostic paths towards an easier integrated surface. A laboratory test is an intervention, and intervention is of any kind, could be a diagnostic or therapeutic, is appropriate only if it is more likely to benefit than to harm the patient and can be done in a reasonable cost and with a reasonable risk. The laboratory test provides information which help the doctors to provide better and more effective care for their patients. It is often cited that laboratory results are integral part of every medical decision. Laboratory results are components of 70% of medical claims is equal to 70% of medical decisions is equal to 70% of medical records. The factors influence the organization of laboratory, the significant technological advancements, full laboratory automation, molecular diagnostic technique, biochips, new generation sequencing, expanding the genome studies, POC solution, etc. Economic pressure limit laboratory budgets as a part of initiative to reduce cost causing laboratory service. Laboratory errors do not reside in the labs. From the patient perspective, every error is perceived the same, pre-analytic, analytic, or post-analytic errors. Most of the errors occur outside the laboratory due to various pre-analytic factors. A large number of errors occur post-analytic phase as well. In recent times, the errors in analytic phase got significantly reduced. Emphasis on a significant reduction of errors related to the immunology test that seriously influence patient's health condition. This is like this. Next. An inappropriate test is ordered 20% of total diagnostic places. An appropriate test is not ordered in 45% of total tests. An appropriate test results in misapplied due to insufficient knowledge, unsuccessful synthesis, there is no integration of results, confusing results, sometimes no awareness of test limitation. An appropriate test is ordered, but a delay occurs somehow in the total testing process. The result of appropriately ordered test is inaccurate. To improve the situation, it is essential to improve close cooperation between doctors and laboratory experts. This would enhance laboratory testing efficiency. Experts inside the laboratories should take control over these processes in which they naturally have better insight. Recommendation from minimum number of retesting attempts in biochemistry. Recommendations of UK Association from Clinical Biochemistry and Laboratory Medicine from UK. Conduct the test when needed. Small group tests like electrolytes in plasma, hemoglobin, prothrombin time. Get tests done once in a lifetime for hereditary diseases. Example, a genetic test for hereditary reasons. Never order for hospital patients. For example, lipoprotein as a cardiovascular risk factor may not be necessary for all cases. Never order for a positive result. For example, trypanosome pallidum particle agglutinin is positive. Don't repeat number of times. Not order for more than once or longer for C-reactive protein. Not order more than once a month. Antibody testing for hepatitis B, C virus infection. Not order in 3 months interval. For example, HbA1c for diabetes. Once a year, example, kidney function for patients with stable diabetic disorders. Never repeated. Example is vitamin D as a group population-based screening. Report and references interval standardization. The laboratory results reports enhances the process efficiency through a synthesis of data, knowledge, and information. Whether due to a lack of information, bad readability, or incorrect references intervals, an awkward structured laboratory test report can have a negative effect on laboratory test interpretation. Reference interval. It is a recent study performed by Italian Society of Clinical Biochemistry shows that laboratory result reports for urine albumin still results with wrong terminology in more than 40% of national laboratories. Even though the concept of reference interval is a part of laboratory culture, it is crucial to investigate the standardization methods to monitor reference intervals. ISO 15189-2012 states that biological reference intervals has to be revised and confirmed every time whenever a variation in the analytic and pre-analytic phase occurs. Standardization is harmony. Prior to standardization, most of the laboratory was found on different systems. The standardization measures harmonize the test performing which are interpreted inside the predefined and revised interval frameworks, like until today, from today onwards, method-dependent results, method-dependent reference interval, standardized methods that provide traceable results, traceable reference intervals. Within the United States laboratories, they are certified Centers for Medicare and Medical Services, CMS under CLIA, that is Clinical Laboratory Improvement Amendments Program, impacting diagnosis, identifying the abnormalities. Laboratory professionals produce an accurate, sensitive, and specific information using the most current technology to guide a clinical decision making. Patient care management. Here, they are used for monitoring the effectiveness of parenteral nutrition treatment, which part is less and which part is more, either a protein or carbohydrate or a fat material. Ensuring a proper dosing in a medicine, monitoring harmful effects of therapeutic drugs, identifying the causes of infection, determining the effective antibiotic therapy, monitoring the effectiveness of cancer therapy, providing a real-time decision support. Univance is an innovation and transformation towards value-based laboratory medicine. A total 12 best practices in 2019 and 24 best practices in 2020 by Univance award cycle. 7 important dimensions were identified for improvement and innovation in the context of value-based laboratories. One is patient flow, patient experience, and new service models. They include reconfirmation and changes in the way patient access, how and where blood samples are collected from the patient, how waiting lists are managed, different ways of designing a report, how the information is given back to physicians and patients, reorganization of labor through multidisciplinary and multi-professional teams, specific and/or customized design on the delivery process of Specific targets, changes or innovations in flows, request booking access, waiting, collection, production, and feedback. Any innovation and new action that increases and improves the experience of clients. A productivity and efficacy, safety of the procedure, networking issue, clinical governance, adopting or developing disruptive technology, finally leading to a research work. Insights and best practice for Univance, several major threats were identified. One is improving systems and safety standards, less risk with better monitoring, better alert and early risk detection, less burden on laboratories for stronger laboratories. Second one is multidisciplinary, multi-professional teams, less for more, leading research with new tests and models for better results. New delivery models through a point of care, improved tracing, better communication for stronger impacts, synergizing laboratories, physicians, and patient to improve the clinical governance. EHMA is European Health Management Association, is not a profit membership organization that enhances the capacity and capability of health management to deliver a high quality healthcare. Reposition of the clinical laboratory as a strategic pillar of the value-based healthcare organization, consistent with Clinical Lab 2.0. Created added value services that improves the patient care and have a health insurance accountable care organization, ACOs, and health networks pay remuneration to the clinical labs for those added value services. Pathologists, clinical chemists, and medical technologists lead the medical labs. Mark Dixon is the president of Mark Dixon Group, is a webinar who has sponsored Sunset Information System and Dark Report Sister publication of Dark Daily with 30 years of experience. The fundamental changes that will impact all clinical laboratories are a continued shift away from pure fee for service payment volume to value-based reimbursement that rewards the improved patient outcomes. More discussion regarding prevention of illness. This is very, very important for disease prevention of illness and chronic disorders like tuberculosis, and finally, the personal responsibility. More focus on primary care and proactive care. Rapid advances in science and technology that will speak development of new healthcare applications. A continued trend towards consumerism as a part of patients pay larger portion of their healthcare expenses shop for hospitals, doctors, labs, and intense cost pressure on healthcare organizations and their medical laboratories. In conclusion, the introduction of mutual reference intervals should solve the problem of reference interval deviation between different laboratories and offer more relevant data. Laboratory experts need to play an important role in improving clinical effectiveness in modern health. No medical specialty can answer every question in this aspect. Thank you very much. Om Sai Ram.
Thank you very much, sir, for such an interesting presentation. And in his presentation, sir has emphasized the importance of communication between the clinical personnel and the laboratory personnel to avoid miscommunications and to ensure better patient care. And he has also emphasized the importance of lab personnel acting as consultant doctors, and they need to advise to order and interpret the results to the clinicians as well, so that there will be an appropriate laboratory clinic interface, which will be very useful for the management of the patient on the whole. And also, sir has emphasized a very important aspect of the services where multiple factors can influence the laboratory services and what are the possible errors that can happen in the pre-analytical, analytical, and the post-analytical phases, and how possibly they can all be managed. And the standardization, which is a very, very important factor playing a role in the laboratory services and the value-based laboratory medicine. Thank you very much, sir, for giving much input on the laboratory services and their application at the level of clinical medicine.
Welcome, madam.
Thank you, sir. A request to the participants, if you have any queries, please put it up in the chat box because the session is very short duration. So the resource persons may not be able to answer your queries in person. We will be sending them your queries if there are any, and we will get the answers from them and post it back to you. Now, we'll move on to the next session. Our Honorable Vice Chancellor, Professor Subhash Chandra Parija, sir will be talking on strengthening of clinical lab services, prepare, connect, innovate, and respond. Sir does not need any introduction. He is such a renowned personality and a beloved Vice Chancellor of our university. I'm just giving a very brief introduction about Professor Subhash Chandra Parija, our Honorable Vice Chancellor, Sri Balaji Vidyapith, Puducherry. Sir is an eminent academician, erudite microbiologist, researcher, and keen votary of medical education and able administrator. He was former director of JIPMER Puducherry, and he has authored 16 books and 400 research papers in national and international journals. He has been listed among top 2% of scientists globally in the field of tropical medicine, and he is an FAO WHO expert member on foodborne parasitic diseases. Sir has received Dr. B.C. Rai National Award, MCA, in the year 2003 for his nodal contributions to the development of medical microbiology. Sir is the founder of the Indian Academy of Tropical Parasitology, and he is conferred with various fellowships. The floor is yours, sir.
Thank you very much, Professor Soumya. Am I audible?
Yes, sir.
Good afternoon again. Esteemed Professor Shyam Prasad, Honorable Vice Chancellor, Dr. NTR, University of Health Sciences, Vijayawada, esteemed Professor Raj Madhav, Vice Chancellor of Baba Farid University of Health Sciences, Faridkot, Haryana, my good friend since last 4 decades, and all participants for this webinar program on a very interesting topics. As a infectious disease specialist, that is a clinical laboratory services, their importance in modern healthcare and role in health sciences universities. At the outset, on my behalf of our Chancellor CMK Rajgopalan, and on behalf of the entire fraternity of Sri Balaji Vidyapith, to welcome you all for this program. I also take this opportunity to thank profusely my co-speakers, Professor Shyam Prasad and Professor Raj Madhav, having taken up their valuable time to be amongst with us and share their valuable experience in this topic of clinical laboratory service. Again, I like to thank Dr. Shyam Prasad. He has made my job very much easier by having a nice critical analysis and presentation on help necessary and the need of value of clinical lab service in healthcare. He has nicely cited the Association of Italy and many other international bodies and their recommendations to strengthen laboratory service. As Dr. Shyam Prasad has rightly told, the laboratory, clinical laboratory service plays a most vital role and important role in making good clinical decisions and that will obviously for the benefit of the patients. So today, what I'm going to share is the strengthening of clinical laboratory service, how we can prepare, connect, innovate, and respond. I'll take 20 to 25 minutes to deliberate on this topic of strengthening clinical laboratory service. My plan of talk, is the slide moving now?
No, sir, not yet, sir.
Not moving?
No, sir, not moving, sir. It is still in the first slide.
You call that, send that fellow same problem.
Yes, sir. Yes, sir. 1 second, sir.
Actually, in this, you see, again, same problem. My slide is not moving, I've been telling. Do that. Same problem is happening in my computer.
Soumya ma'am,
Sir,
the slides are moving.
no, sir.
1 second.
No, sir.
Is it moving now?
Sir, you can put it in slide share and check, sir, once again.
Moving, I'm telling you. It's not moving.
Sir, the IT person is coming and he will check it once again, sir. It has moved on to the third slide now, sir. Now it is seen.
Moving?
Ah.
What's the problem? No, tomorrow, immediately. Sorry for the error. Is it moving now?
Yes, sir. Yes.
Yeah. So this, I'll take 20 to 25 minutes to deliberate on the various aspects of today's topic I've been given. First, I will just share a few minutes about the services being offered, the laboratory health services, and the most important thing, what is the basis for this type of service? That is the drivers for the demand. Having told that, then again I'll little deliberate on the Indian's clinical laboratory service market landscape in the context of the world background. And recently, as we know, in this COVID-19 pandemic, there has been a paradigm shift because of the strengthening of the clinical laboratories like RT-PCRs. Then why we should strengthen the lab and how to strengthen it. Then I'll list some strategic roadmap, and of course, to achieve a functional, supportive laboratory service, the need and requirement of human resources. And I'll conclude giving few examples of networks and collaborations. Just I like to begin this interesting slide that I borrowed from World Health Organization. A statement that is strategic framework for strengthening health laboratory services in 2016 and 2020. Their goal were 4 important goals. It emphasized the need for strengthening of sustainable national health laboratory systems to improve clinical and public health services in the country hospital cross-cutting manner for better preparedness. Second was surveillance of and response to epidemiology of prone disease. And while one does that, one has to take account the health security concern and the other potential emergence of public health concerns. That is the most important basis of the strengthening health laboratory service that are recommended by World Health Organizations. So this has triggered a lot of activities in various continents and subcontinents. Just to give you example, is the activities of the concerned effort has been made, for example, of strengthening public health laboratories in the WHO African regions, a critical need for the disease. It's an interesting piece of document which discusses in details the relevance, the strategies, and the process to strengthen public health laboratories that can be adopted to any country. When we talk about an Indian scenario, obviously, the integrated disease surveillance program that launched by our NCDC, New Delhi, under Director General of Health Services, speaks and emphasizing a lot on laboratory strengthening, how to strengthen our laboratory in India, in our country. These are most important components that first and foremost is laboratory audits and action plan development, followed by formal LQMS curriculum and in situ training. Third, strengthening of the manpower resources by mentoring of laboratory staff, and to reach the people in the distant area, unreached area, by the adoption of the modern technology that is remote telementoring. I won't go into detail of each and every component, but the essence of these 4 strategies that includes laboratory audits and plan development, training for laboratory staff, and remote telementoring, it has one important outcome. That outcome is that improved knowledge of quality improvement and capacity for quality management. And that improvement is compliance to ISO 15189 standards. And third component is improved quality. So this document suggests us 3 important components. Effort that is directed to make capacity building and quality management, and the benchmark that is being given is the ISO 15189 compliance. And after all, it is a quality assurance program. Most important is the quality that is being integrated with any type of laboratory test being performed in a test. So when we talk of these other things, there are a lot of guiding principles for investing in a health laboratory system. First and foremost is, I'll start with the efficient quality and laboratory service delivery. The laboratory in a tertiary healthcare system, like in a medical college or the universities, or in a non-teaching large tertiary hospital, or anywhere, primary or district health center. that is focused on efficient and quality laboratory service delivery. That is the key component. Because if this is why one is emphasizing on this efficient and quality laboratory service delivery, because this is based on country context and need. And again, that is achieved by integration of laboratory services and systems, and to be sustainable, accountable by country ownership and hospital ownership. So this is the system in which many components are aligned to this to deliver efficient and qualitative laboratory service. Now, as Dr. Sam Prasad has nicely delivered a wide number of tests spreading across the domain of biochemistry, the domain of pathology, the domain of microbiology, and other allied health sciences. We just can broadly classify. Like this can be routine test, common test for example, cholesterol, HIV, pregnancy, etc. While the patient comes for the particular problems admitted in the hospital. Second important component, not that this service offered is only routine, just a support test, but it has got another important component, laboratory test to monitor disease and drug treatment. That it means, suppose a patient is suffering from meningitis, we have started specific antibacterial treatment. Then again, lab services support to monitor how, for the prognosis, how this disease is progressing and with the effective treatment. So the second component, to monitor disease and drug treatment. And of course, in this era of 21st century, we find a lot of new tests in the ammunition of laboratory tests that includes genetics, immuno-oncology, endocrinology, molecular and other things. And this test is really taking over the routine and traditional test for supporting the management and treatment of the patient. And the classical example is COVID-19 epidemics, in which we have seen how a very sophisticated test like real-time PCR has been successfully integrated in supporting the disease management and treatment. So, as I told you, what are the drivers for the demands of these tests? In this modern evidence-based healthcare system, the role and influence of clinical laboratory has become indispensable. We cannot have a comprehensive support of and treatment of the management of the patients without support of lab services, because more than 85% of diagnosis and treatment decisions are definitely based on clinical laboratory results. Hence, why suddenly there is so much of quantum jump of the need for the laboratory test, even up to 85%. What are the changing factors, changing scenario that has been taking place? There are many factors. For example, increase in lifestyle disease, diabetes, hypertension, and so on. And awareness and affordabilities. Public is become more aware, more knowledgeable. They themselves want to screen and increase in socioeconomic status, higher economic levels across the startup societies, change in demographics, and spread of healthcare services and insurance. That is also triggering and promoting the support of laboratory tests. And that is the, as I told you, the recent COVID-19 pandemics and possible future threats, people like must be confirmed or rule out of these infections. With this background, I'll just share with few slides what is the laboratory services stands in India, in the Indian landscape. Currently, it stands around 675 billion of Indian rupees. Very large figure, and is expected to grow at a compounded annual growth of rate not even around 10%. But unfortunately, Indian diagnostic industries is highly fragmented and underpenetrated. Just I share the spread of Indian diagnostic industries. How much is being shared by different components? Of these 675 billion industries, hospitals with own lab, they have a share of 37%. Standalone centers, 47%. Then diagnostic chains, 16%. Regional chains, 11%. And pan-India centers. And one classical example is that in this decade, you'll be surprised, we have got more than 1 lakh labs of this, either in hospital or standalone or regional chains. And these 1 lakh labs are catering to this problem of the systems. Again, I'll just give an example with COVID-19 pandemics. In the 2020, when just COVID-19 was starting, there are 14 COVID testing laboratories were beginning in the pandemics. But currently, there are more than 3,128 testing labs spread across the country testing these fields. And as you discussed, that it must be all these labs to be quality conscious. How are certified that the lab is quality conscious or not? NABL is one of the strongest parameters. And fortunately, there has been a steady increase in the number of NABL accredited labs from the 160 labs in the east to around 3,302 labs in the south. Everything has been possible. There's a tremendous development, tremendous change, particularly in the 2 decades in this laboratory health service or laboratory technologies. This has been fueled by 2 important factors. One is paradigm shift in integration of the newer technologies, molecular, other methods. And second, in this industrial evolution of 4.0, integration of the technologies like artificial intelligence, big data management, all those components are fueling the demand for this shifting of the traditional test. When we were students in last century, in 1970s, 80s, we were very much, most of our tests were manual. In our microbiology, it was mostly morphological, demonstrated by microscopy, then shifted to serological. Then in this 21st century, molecular and other methods. But now in this 21st century, you'll be surprised that so much of shift leading to automation, technology-dependent molecular testing, and testing supportive to precision medicines, personalized medicines, gene therapy, and so on. This landscape is becoming crowded with these newer methods. Question asked, why the strengthening of laboratory service required? It requires for various causes. First and foremost is to meet the demand-driven market. Second is to better augment newer modality of treatment, including precision medicines. And third is to cope up with the changes proportional to the advances of science and development in healthcare. And obviously, everything focuses to a single concept to improve patient outcomes, assuring patient safety, and fulfilling essentiality of public health service functions. So, having told the need for strengthening, then how to strengthen? We must have 4 important components. One is we must prepare we prepare by building a sustained, robust system, by training of the manpower, by technical reportings, and following the safe practices. CONNEcT, as Dr. Prasad has told, connectivity with the laboratory health technologists and with the clinicians to promote patient-centered solutions to reduce diagnostic errors. Because as you rightly mentioned, Dr. Prasad, for a patient, error is error. He is less bothered with the pre-analytical, analytical, post-mortem things. So the main component of the strengthening is to promote patient-centered solutions to reduce diagnostic error, connecting world-class physicians and healthcare leaders to laboratory professionals through diagnostic teams and others. There should be connectivity. There should be good connect between the laboratory professionals and the clinical healthcare providers. And science, everything is developing. Decades is developing. So to keep up our fast pace of development, one must innovate. Unless you innovate, you are at the background. So we have to innovate by creating a technology-based decision support tools, such as mobile applications, to support appropriate use of laboratory service. And that is also to training, enhance lab competencies in the laboratory manpower, and respond. We must respond fast. We must strengthen clinical laboratory capabilities by establishing a national laboratory outreach communication system and provide available specimens. So in essence, when any component or we are given opportunity as head of the institutions or universities to strengthen the laboratory service in our institute, we must keep in mind these 4 components of prepare, connect, innovate, and respond. Then only the laboratory service will have sufficient qualities, and that will be useful for the patient safety. To end, just I'll give some examples of strategic roadmap, strengthen the leadership and governance of the laboratory system, strengthen organization and management of the laboratory systems toward quality. For example, in India, quality that's to be recognized by NABL, price certifications, and establish and strengthen sustainable, sufficient, and competent human resources for laboratory service delivery in performing the test, in transferring the results, in delivering the test, and establish modern laboratory environment by upgrading from the past. We must move forward from the traditional systems of manual, non-automated to cost-effective, automated, and integrated technologies like telemedicine, artificial intelligence, and promote networking in country and among country, and enhance coordinations, and of course, promote rational and evidence-based use of laboratory services. That is most important for having a good clinical diagnosis and decision makings. And in any component in a hospital or lab, it is not the hardware, means it is not the instrument, or it is not the building that gives you the qualitative laboratory service, but it is the manpower, it is the human resources that needs to be strengthening and augmented. Then that will contribute a lot for the qualitative manpower, qualitative diagnostic test. So to strengthen networking and collaboration activities, on the information about the network and services and knowledge management. And that is what most important is, the knowledge management. That knowledge management network, standards, standard operative procedures, guidelines, protocols for performing the test, and community of practice of laboratory experts. So dear my participants, I'd like to conclude that this 21st century is a century of expectation and optimization of modern healthcare services that will play an important role in good decision making for patient healthcare. Hence, the clinical lab service industry is expanding at a very tremendous rate. This has been aided further with scientific and technological advancement, and that paradigm shift in laboratory is visible across the country, in a standalone lab, in the lab, in the institute, hospitals. But as I mentioned, the overall strengthening shall require 4 components: prepare, correct, innovate, and respond approach. Then that will ensure quality, and that will contribute for the good decision making in clinical decisions. Hence, to do so, a strategic roadmap focused on strengthen, establish, and promote components involved should be targeted at application. Thank you. Thank you very much for your patience hearing.
Thank you, sir. It was a very informative talk and insisting upon the quality assurance and all the best practices we have to follow in the laboratory. Thank you very much for the talk, sir. To have a brief gist of whatever sir has told so far, sir has talked about the best practice theme where the audit and action plan has to be taken, followed by the laboratory quality management system with the curriculum and training, the in situ mentoring, followed by the remote tele-mentoring, which is essential for the laboratories, which can maintain and sustain the quality in the laboratory reports. And mainly to infuse the concept of ownership and accountability in the laboratory, so that there can be integration of the lab services and the system-based and the systems based on the context and the need for these services. And coming to the drivers of demand, the awareness and affordability, which are very much developed nowadays in the patients, and the availability of the insurance, the recent occurrences of the pandemics and the expected future threats, which actually are driving forces for majority of the innovations and the necessitating the quality maintenance of the laboratories, and thereby increasing in the training and the maintenance sustainability of the lab. And sir has insisted on the accreditation of the laboratory, especially by the NABL accreditation, and the need for the shift to the automated and technology, improvement in the technology of the laboratory services. The necessity which has arisen in the level of molecular and precision testing, and the newer technologies which has to be incorporated. And more than all, sir has emphasized on the importance of human resources, how we have to take care of the manpower in the laboratory, how to train them, and how to network and have the collaborative activities. And considering that sir is from the laboratory background, all these inputs are very, very valuable, and sir has shared his experience based on his vast experience in the laboratory services. Thank you so much, sir. Now we will move on to the third topic. Okay. Once again, I request all the participants, in case you have any queries, kindly post it in the chat box so that we can get the answers and the clarifications from the speakers later on. The topic, clinical lab services and their support and augmentation in Health Sciences University, is the third session for today's webinar. And this topic will be taken by Professor Raj Bahadur. Professor Raj Bahadur is the Honorable Vice Chancellor of Baba Farid University of Health Sciences, Faridkot, Punjab. Sir has done his MBBS from Himachal Pradesh University, Shimla, in the year 1974. He has done his MS Ortho in the year 1979 from Banaras Hindu University, and he has been the project director and member secretary of the Regional Spinal Injury Center, Mohali. He has served and is serving on various universities and committees of Safdarjung Hospital and Maulana Azad Medical College, New Delhi, Government Medical College and Hospital, Chandigarh, RSIC Mohali, and PG Mer, Chandigarh. He has made functional the Advanced Cancer Institute in Bathinda, and it is now available for treatment of cancer patients. And Sir has established a Rain Bazira worth 2 crores for the comfortable stay of attendants of the cancer patients. Sir has been nominated as the nominee of Vice President of India at Punjab University, Chandigarh, and he has been elected as member of National Medical Commission in the year 2019 to 2020, constituted by the Government of India in supervision of the Medical Council of India. Today, Sir's topic is going to be very essential in the form of how the clinical services and their support can be made as a augmenting factor in the health sciences university. So far we have been listening to the experts who have been telling about the laboratory services, how they have to be maintaining the quality and what are the training programs and the future of the services. Now, Sir is going to talk about how it can be useful in the augmentation of the health sciences university in the context of universities. We'll just wait for a few minutes. Now, there is some technical issue. Sir is rejoining now. We'll wait for a few more minutes, and sorry for the inconvenience. பேர் இப்ப இன்னும் வரல இல்லையா? வந்துட்டார். Good afternoon, sir. You could join back.
Yeah. Am I audible, my dear?
Yes, sir. Yes, sir. You are audible.
Slide. Professor Parija, I'm sorry for this glitch. Are you able to listen?
Sir, yes, sir. Yes, sir. We are able to hear you, sir.
Bring your slide. Bring my slide.
Computer issues are there.
Yes, sir. Sir, we are now sharing your PowerPoint from our computer, sir.
I'm not able to see you now.
Sir, just 1 second, sir. We are sharing it right now. Sir, are you able to see, sir?
Are you able to see my slide now?
Yes, sir. Now the first slide has come. We are sharing it from here now, sir, from our computer.
No, I'm also putting my slide, no?
Oh,
Can you see this?
sir.
Can you see my
Able to
slide?
do, sir. If no, sir, not yet visible. We will share it, sir. It is coming in this computer, so we'll be able to share, sir, if you don't mind.
Now it's okay?
Sir, now we have shared it from our computer, sir.
Okay.
Are you
Okay,
comfortable with this, sir?
Okay. Dr. Parija, I'm extremely sorry for this. This is a
Please carry
on
on.
this side. It's unfortunate. It is an opportunity for me to be with you again after many months. And the topic which is given to me is its application of the lab on the side of the clinical sites. Okay. To the students, I would like to say that when we were students, and even till now, we feel that the diagnosis of a disease can be made by history, if you take a good history, by 80%. Good history will be able to contribute to the diagnosis by 80%. And if the clinician touches the patient, he gets another 10%, and the labs helps by another 10%. But Professor Parija has made a bold statement today, which I think I am taking with a pinch of salt, that 85% of the diagnosis could be made by the lab. Okay. So with this statement, I go ahead. Next slide, please. Next slide. Next slide, please. This is a slide which, please go back. Please go back. Yes. Look at this slide. No, next slide, please. Next slide. Yes, ma'am. Keep it here. Keep it. No, go back, madam. Keep this slide for 1 or 2 minutes, please. Please go back. Next slide.
This image, sir, is it okay,
Yes,
sir?
this image I wish. Keep it
Okay,
for
sir.
some time.
Sure,
Till I
sir.
say the next, okay?
Yes, sir.
This is a MRI of the dorsolateral spine, where you can see that there's a hyperintense lesion and the vertebral body is collapsed. This is the side view. And then this is in the middle is the front view of the spine. And then there is the axial section. Probably when we were postgraduate, when Parija was also there with me in 78 at Banaras, this facility was not existing, but this today tells to me that there is a tumorous condition existing in the spine, which is tending to press upon the spinal cord, and the patient has an impending paraplegia. This was not possible. We were only seeing the X-ray, or if the patient is presenting to us with some manifestation clinically, only then we could make the diagnosis. If you see in the axial section, the total spinal cord is compressed by the tumor, and the tumor more is toward the left side. Slide, please. Next slide. Then I observed that this is a tumor which is hyperintense, looks like a more malignant tumors, maybe more vascular. We could do the embolization of the tumor. The first slide on the left is where the tumor has been showing that this is the tumor which is existing. And after the embolization, you can see that the tumor substance is not visible. So we embolize this patient, and it is important that we should be able to do this surgery next day. Slide, please. Next slide. We operated this patient from the back and fixed the spine. And since the tumor was on the left side, we removed the tumor, and you can see the white is the spinal cord. We turned the patient, brought to the front side, put the screw and removed the total tumor. The middle slide shows that the tumor has been completely removed from front. This is we go through the chest and remove the tumor. And the space which we have created has been filled with the cage, which is a titanium cage, which is lying between the two screws. Next slide. Next slide, please. And again, from the front, the spine has been stabilized. This was not possible in the beginning. But the emphasis lie here is that unless we have a facility like a embolization, this was not possible at all. Or we would have created a catastrophe on the table by producing a massive hemorrhage, and the patient might have died after the surgery. Having said this, next slide. It is important that we must have the various laboratory tests. I go back to my undergraduate period when at Shimla in 1974, we learned that the serum electrolyte is possible at Shimla. Before 74, the serum electrolyte was not possible. Now, with the investigation which are available to us, we can see the glucose, electrolyte, trace elements, mineral, liver function, renal function, cardiac markers, proteins, diagnostic enzymes, tumor markers, hormones, and other metabolic can also be analyzed. Commonly tested are the blood, urine, and CS. It requires a variety of techniques like fully automatic analyzers, HPLC, mass spectrometry, chemiluminescence, atomic absorption, and spectrometry. All these tests are so useful for diagnosing the diabetes, cardiac diseases, liver diseases, renal functions, and bone diseases, and various cancers and hormones. The most recent test which could also be incorporated is troponin T, proBNP, ferritins, and all these tests, they are available, which are helpful for us to diagnose and treat the patients. Next slide, please. If you go toward the side of the radio diagnosis, Many years before, when we were students, there was only plain X-rays. Technology has provided a sharper images of a higher resolution and a smarter method of tissue characterization. This was not possible. In the plain X-ray, we could see only the bone or the soft tissue. But now it is possible to characterize the tissues. It provides immaculate isotropic real-time 3D volumetric image acquisitions, truly representing the anatomy, physiology, and the pathology. That's the beauty of these tests which are possible now. And from the basic anatomical diagnosis, it has moved to the clinical management of the patients through providing an image guidance for the biopsies. Even for doing the biopsy, we need to open the patient. Now it is possible to do the FNAC, and precise therapeutic injections we can do. We can put the root blocks. Disease like trigeminal neuralgia can also be blocked with the help of the injections and also the radio frequency ablations. Various emergent and electric interventions like remobilization for management of the bleeds, clots, for occluded vessels, stent placements to establish patency of the blood vessel, renal tract, hepatic ducts are in domain of the radiology. Tumor management by targeted chemotherapy has also now incorporated in the radio frequency with the ultrasonic and the cryogenic ablation. So when we go to these services which are now developed, now it is possible, there's a sea change which has happened over the years. True value of a professional managed radiological services can only be realized if it is digitally integrated with the hospital services through a picture achieving and a communication services pack, which provided a connectivity by availing the result at the touch of a button. This was not possible. When you go to the Western country, it is possible that while sitting at one corner of a hospital, you can see all the investigations which are being done at a different places. So the lab changes, as was mentioned by Professor Parija, which was not possible earlier, is bringing an effective change in the management and the diagnosis of the patient. Automation in the form of a blood culture systems in microbiology, identification system. Next slide, please. Next slide. So automation which has added to the blood culture system. It was possible to do the blood culture. Now the blood culture can also be automated. Identification system, antibiotic susceptibility system. It is possible to find out which antibiotic would be required for the patient, and the antibiotic susceptible system are automated systems, they are available. The most important thing which we have seen in the COVID is the point of care tests, which have made life so comfortable. We were doing the RAT test, simultaneously we were doing the RT-PCR test also. Professor Parija, I must tell that in the beginning of the COVID, the capacity of Punjab was only 40 samples to be done. In all the medical colleges, the capacity was 40 samples to be done. But by the end, and now even today, we have the capacity of doing the 50,000 samples per day, which is a great achievement by virtue of the laboratory services. We have created the 7 labs in all medical colleges, and in addition, they are also placed in the other places. 20 labs are being created in the districts. The molecular diagnoses are being made. Even the genome sequencing facility is available at all the medical colleges, means the Amritsar Medical College, Faridkot, as well as the Patiala Medical College. So this will certainly tell us which virus, which mutation, which is existing, and how it can be diagnosed and treated. I think this is a magnificent change which has happened because of the laboratory services, and it is only essentially because of the contribution by the laboratory sites. On the side of the cancer, in Punjab, it is a significant belt. The setting of a clinical nuclear medicine department at Medical College Faridkot has been next slide, please. Next slide, yes. We have this facility ever since 2013. PET scan, CT scan, SPECT, CT, these facilities that are existing, which have absolutely made a great change. This is a diagnostic things. They are used for the treatment also. The artificial intelligence, virtual intelligence, digitalization of the pathological labs, it has reduced the staff satisfaction and improved the patient outcome. These are the facilities which are there. And I believe that the clinical application, which the statement which I made in the beginning, that the diagnosis used to be made with the help of a history, 80%. And Professor Parija has said that the laboratory has made change by 85%. I think we are coming in close to each other. And the laboratory services, I feel, they are so important. And until unless the laboratory services, they are available in the medical colleges and in the university, I think we will lag behind. And this webinar will certainly be useful to see that we are able to make a sea change in the diagnostic and the laboratory services in our institution and get the benefit of the laboratory services to the patients which we are treating. Thank you very much.
Thank you.
Thank you, sir. It was a very crisp and clear presentation. Actually, when Parija sir told about more than 80%, 85% of clinical cases are diagnosed and treated based on the laboratory results. So, sir has developed from that note, and he has emphasized how all the laboratories, right from the biochemistry, pathology, microbiology, and the radiology sections, they contribute not only for the diagnosis and also for the intervention and the further management of the patients. And especially with the invent of technology, the artificial intelligence and digitization, the virtual intelligence, how it is useful and how it is influencing the patient care and the patient outcome. Thank you very much, sir.
Thank you.
Thank you.
So we come to the conclusion of this session. Here we have our three experts talking about the laboratory and its performance, how it can be utilized by the clinicians in a better environment, and how it can be utilized for the patient care and management, and what are all the future, the digitization, the augmentation of technology, how the quality can be improved. And thank you all. Thank you to the participants for your patient listening. And I thank our Vice Chancellor, Professor Subhash Chandra Parija, for giving such a interesting topic for discussion today. And I thank our experts, Dr. Shyam Prasad and Dr. Raj Bahadur, for being with us today in this discussion. Thank you.
Thank you very much, Professor Raj Bahadur and Professor
you.
Shyam Prasad. Thank you. Dr. Raj Bahadur, you have very nicely commented on this clinical acumen. As you rightly told, when we are students now, when we are at the fag end of career, entire diagnostic synergy, entire change, things beyond the imagination. And it's moving very fast forward. We have to catch it.